All right. Well, just because the health care bill didn't go through doesn't mean there's not a shortage of news out there. Kevin Quirk reporting live at the White House. Thank you so much. And after a chaotic week on Capitol Hill, we did go out and ask tourists here at the Tidal Basin their thoughts on the battle over health care. Take a listen.
We got to get rid of Obamacare. That's absolutely for certain. I'm kind of with the conservatives that we need to go a little bit more conservative on some of the issues. We don't need health care to be increasing in the next 2 or 3 years.
I'm more of the opinion that it should be fixed the way it is. It's not perfect, but let's improve it.
My personal feeling is that we ought to have universal health care like some of the European countries have. But that'll never happen with our political system. So what can I say?
Well, as we know, there is a divide in Congress between those who supported the repeal and replace and those who did not. So what do those lawmakers think who would have voted yes? Congressman Robert Pittenger of North Carolina supported the health care law, and he joins me now, may I mention, on his 39th wedding anniversary. So, sir, congratulations, and thank you so much for joining us on this day today. I want to ask you, as the dust is settling, your reaction today.
Well, it was a sad day yesterday. I think we need to take a lesson from Ronald Reagan, a great conservative president. Ronald Reagan's governance was based on the 80% rule. If he could get 80% of any bill, he would declare victory and know that he had achieved his objective. And I think we can't go into any consideration of legislation and anticipate that we should get 100% of what we want. We're a conference.
Okay, but that being said, so for those members, were they not getting 80% of what they wanted?
Well,
and specifically, I'm referring to the Freedom Caucus members, some of the most conservative members of Congress.
I think some of them wanted 100%. They wanted fully their way, and you have to be considerate of those who live in districts that are far different in demographics. They have more seniors, they have more people who are in poverty. They may have rural and urban. Our districts are far different, and you have to recognize in a body of 240 people, we all come from different perspectives and different recognition of issues that we must address. And so I think it got a little stringent in having to recognize them for their requirement for 100% of what they wanted. That's why the principle of Reagan is so important. And following that 80% rule, if we'll follow the 80% rule, we'll be able to get there.
I want to ask you what you're hearing from your constituents this morning and those who maybe wanted to see a vote take place. Is that because they wanted some blame to go around, or they wanted to be holding those lawmakers accountable because they didn't get that vote?
Yes, I just voted I just spoke this morning out in Rockingham, North Carolina, a small rural community, to a number of our Republican members out there at their county convention. And they were absolutely livid. They were so mad that we did not pass this bill, that there are a number of people who held out, 20 or whatever people who would not agree to make sure that we could pass this conservative reform. And they just were very angry because they knew that this would bring health care back to the states, it would lower the premiums, it would give health care back in the hands of the American people, it would reform Medicaid, it would reduce taxes by $1 trillion. Remarkable reforms.
But sir, if I may interrupt you, because it does sounds great on paper, but wouldn't the Senate have just punted it anyways? I mean, would we have seen any progress in the upper chamber?
Well, you take it to the Senate. That's our democratic process. That's how we legislate. We pass this bill in the House, and they take it to the Senate, and then they do the reforms that we want to do. Then it comes back to us. So I think we had to go to first base. First base was important, and we didn't get to first base this time. Beyond first base, then the Secretary of Health and Human Services has the right to address 1,200 rules that were written in this law when it was that the Secretary of HHS had the right to determine those rules. And then after that, then we were able to go into the third phase, which would be legislation that would open up state lines and would allow us.
Okay, I want to ask you quickly. We've been talking about that opening up state lines, perhaps in a later phase in this particular legislation. My last question is: Democrats are cheering this morning. Should they be cheering?
Well, they shouldn't be cheering when next month you're going to have an increase in rates again from the carriers. This is a The reform that they passed, the bill that they passed, is collapsing on its own weight. When Aetna says it's on a death spiral, when Humana says that they're leaving next year, there's no opportunity for this health care plan that they passed to succeed, and it has to be reformed.
All right. All right, Congressman Pittenger, thank you so much for joining us again. Happy anniversary. Thank you, sir. We appreciate it.
Sure. Thanks.
Leland?